The initial phases, 1990 to 1996, at least 6 or 97. Cases would be 5 hours, 6 hours, 7 hours cases.
They were fed up, sir.
They would be given tea, breakfast, biscuit, everything. You asked me everything. I have even paid them money to sit down. I'm not joking, because learning is practical. Learning is not through books. Patients are our teachers. And if we are patient enough with the patients, that is the biggest gift. But today, this gazette has spoiled us. If anybody is the biggest enemy, then that is the biggest enemy. WhatsApp, Instagram, YouTube, podcasts. I don't understand what are all these. When Atik Bhai said podcast, we have to do podcast. I said, what is that? You don't know? You're surprised. As if my life has gone out of it. That I do not know. Because our own work only we are not finishing. Imagine editing the cases. Some cases for miasm part, some cases for kingdom understanding, some cases for level of experience. Everything has to be broken down, and then subtitling has to be done. That takes a big time. Subtitling is not easy. And then the typing of the cases, the text has to be done. Then the source understanding, the source clip which I have showed of the eagle, that has to be done. Animations for the PowerPoint has to be this thing. PowerPoint we have to do. So one case takes nearly around 4 to 5 days. Imagine for one seminar to prepare, it's at least 2 weeks time. And that to 4 people in the clinic are doing it. One does the typing of the case, the second one the subtitling, the third one does the editing. So this is the way how it goes. So it's a big work behind one seminar. It's not so easy. For us, to come on the stage, already everything is ready and to teach. And not teaching, it's just sharing what I have heard and what I have listened. But the real people are the people behind the curtain who are actually doing all these things. And the source clips and all has to be perfect to what the topic is going on. If you see eagle video, there are so many. But this is particular where territory has to be managed. So go in circles, hook it up, and the commentary that has to be completely this thing, and what the patient is saying. If they have come into my territory without my permission, no. This has to fit with the clip. Otherwise the clip is something else and you are telling something else. Will not actually make people understand. But now when you see the clip and the case and the text, everything, then it becomes clear. You will never forget eagle for the rest of your life. This is what the idea of the art of conveying what is needed for the participant. Otherwise many people will talk so much that participant doesn't understand only. And there is a big time problem. Many of them ask me, Shekhar, for your this thing, why people are so happy about it? I said, see, it's not me or you. A good cook is the one who can cater to the person who is needing that food. You might prepare 10,000 recipes, but if that person wants only dal and rice, then what have you done? And that is only not there in whatever you have prepared. Will that person be really happy? No. And that is the reason why, you see, this comes without saying. Many a time the child says, Mama, today I want this. The mother makes it. Yes or no? What are we doing? We are catering to the child's taste on that particular time and day. It's not that the mother will say, no, today I have made this thing, you have to have this only. The child will eat, but the child will not be satisfied eating it. And that is what makes all the difference. Cater to what is needed, rather than just pouring out whatever you know and the person not understanding. That is the reason there is a beautiful story also of it, about Albert Einstein and Charlie Chaplin. Both of you all know. So Albert Einstein really wanted to meet Charlie Chaplin. Desperate to meet Charlie Chaplin. So one fine day, he got the news that in this particular town, Charlie is doing a audition. So Albert Einstein came to that place, sat in the first bench corner chair, waiting for the audition to be finished. Audition finished. Everybody were very happy about the audition and everything. Everybody went up on the stage to congratulate him. Albert was waiting over there for his turn to come, so that nobody is there so I can talk to him. Since everybody came and went, he got a chance. He came up to the stage. And with little hesitation, Albert said, "Charlie, you talk nothing, but yet people adore you so much. What is the secret behind it?" This is what he asked. And Charlie was, how smart he was. He took a pause, not immediately answered. He took a pause. And then he said, "Albert, you talk so much that people don't understand, but yet you are adorable and respectable. In your life, you have talked so much and you did so much. People don't even understand what you have done. But yet people adore you." So homeopathy is like that. There are people who do not talk, yet we have to find the remedy. And there are people who talk so much that we are confused, but yet we have to find the remedy. So we are in between Albert Einstein and Charlie Chaplin. We are a blend of both. Yes or no? So who is to be appreciated more? A homeopath, which is a blend of Albert also and a blend of Charlie also. So this is what we actually face in our day-to-day life. But what is very important is our keen observation. A child which was just about 10 to 12 months old came to my clinic early morning, 4 o'clock. Before that, they went to the hospital because it was crying, bitterly crying. The RMO casualty officer gave some injection, something, and some medicine he prescribed, and said that within half an hour, 1 hour, the child will stop crying. They waited for 10-15 minutes and then they moved out. Their neighbors were my patients, so the neighbor just told him on the phone that you can go to him, he will be there. He called me up also, the neighbor, that this has happened, so they will be coming there on the way. I said, okay, let them come. And I said, what is the complaint? They said the child is bitterly crying and we do not know what. We went to the hospital and they gave injection and everything, but still the crying has not yet stopped. The child, 10 months, draped with all that, clothes and everything and all that thing, langoti and all that thing. I said, remove all the clothes first. Inspected the child totally. And to my surprise, what was the thing, The big red ant that had bitten in between the gluteal muscle. When I observed that, I removed that thing nicely. I put a nice with Dettol and I cleansed it. I told the relative of the patient, go back home. My home is just on the first floor and I'm practicing on the ground floor. I said, tell my wife to give the ice cube. Put it on a handkerchief, rubbed it over there. Within 5 minutes, the child was at peace. The idea and the summary of this whole thing is that we think complicated. That's the problem with us. We always have to have a diagnosis which is big. And the craze in homeopathic world, I'll tell you today, the craze in homeopathic world, even in the academy, OPD and everywhere. What case did you see, sir? Or it was Naturo. Naturo? Pulsatilla case. As though they are outdated. Naturo, Pulsatilla, Naxomica, Rustox are all outdated. What they want to hear is butterfly, earthworm, the snake flying, and the bird creeping, the mammal burrowing, something unique. Arey Baba, unique. The more the unique you do, the more you will be lost in the jungle. You are not grounded at all. So I always tell everybody, especially the youngsters, let the ambition be in the cloud, but see to it that your feet are grounded. And see yet there is a connection between both. Be grounded, have ambition, no problem. But only be grounded and having no ambition is of no use. So see that at least you have the ambition, but be grounded. And that grounded is very, very important. And that is what many of my friends even ask me, why do you go for so many seminars? I said, see, I am blessed to stay nearby Dr. Rajan Shankar. 30 years I got from him. I cannot be selfish to keep it to myself. Let me just spread the word. Many homeopaths who cannot come all the way to Bombay, they can't travel. Not because they cannot travel physically, but it is economically also very difficult to come there, stay cost and everything is very difficult. So it's better one person travels, what big deal? But at least you are feeling that satisfaction that what you have learned from your masters, you are further transporting it to the younger generation for the betterment of humanity at large. How many people will be there who are desperate to want some or the other recovery? And if we play a little role in passing on the message to the generation next, it's the entire homeopathic world that is getting benefited. And this is what our whole aim is. That's why people, like-minded people like Sir and all, we have come together is only with this ambition. That he asked me so many times, what makes you go here and there? Just with a joking this thing, I always say, sir, your teaching is to be spread. Till the time I have strength, I can move around. The day when I will not be able to, maybe I'll just sit down in one place and deliver from there. But at least today, the whole idea is teach the right path. Rather than, and many of the female participants especially, how many years they have missed after marriage? Family, children, this, that. Many of them have not practiced. For them, I have done so many webinars. Coming back to home. That was the title. And what is the content in that? All those who missed the initial 8 to 10 years, till the child could be a third, fourth standard on their own a little bit. They missed so many years. Marriage, then pregnancy, and then after that delivery, after that taking care of the child. So 7 to 8 years have gone. And they are completely out of touch. And I saw them, they are feeling so desperate inside that what have I done of my life? That I got educated, I got the degree, my parents slogged for it, poor thing, and today I am not able to practice. So you also feel something about it. And this brings in that fire inside you that let us help. And then this type of programs. Similarly for 8, 9 and 10 students, girls especially. Parents say, get 90%, get 80%. Arey Baba, you are pressurizing from outside. But remember, inside their hormonal changes is also pressurizing them. There is a war between outside and inside. And that is the time when they are so damn frustrated that they are not able to reveal it to anybody. Because first of all, they are not understanding what is happening to them. And mother says, she was so nice and so polite till 7th standard. God knows what happened. What black magic happened. From the time she has entered into 8th standard, she is not listening only. But she is not listening. Her hormones are not listening. It is the hormones that are making her now travel from the childhood which was dependent to an adolescent which is wanting to be independent. How many of the time has the parent ever asked the child, what do you think about this? Your opinion, please. Any decision to be taken in the family? Nobody. Keep quiet. You don't understand. When will the child understand? At what age will the child understand? This is the right time when the child is traveling into adolescent phase. They should be made to feel that you are also a part of a responsible person in the family, that your decision matters. Isn't this an important aspect? So like this, I started doing parenting. And this is what I exactly tell the parents. Please do not make your child feel that they are not grown up. Whatever decision, even if it's a father's promotion and that topic is being discussed, tell the child. Ask the child, what do you think? The child feels respected, the child feels a member of the responsible member, and they will not leave the opinion on the decision taken by the parental body. Today, why do we see that the children are following outsiders? Running away and getting married, falling in love at any age. Is because we are the people who are actually to be blamed. We have never brought them to the mainstream. We have always neglected them. We always felt their duty is only to study. You only study. Don't be bothered about this responsibility. That doesn't work. Because life is filled with multiple tasks. We all have multiple tasks. So even they have to have multiple tasks. Doesn't mean that we are throwing the burden on them. But give them that feel of identity. That I of the child has to develop. Don't make the child's eye crippled. Big thing there is, big thing. Moment you bring that thing up, you see what is the change in them. How many of them suffer from PCOD these days? 7 to 8 out of 10. What is it happening is because the psycho, neuro, endocrinological, immunological axis. They have already traveled from psycho to neuro, neuro to endocrinological. That endocrinological effect is now showing on them. And then the mother says or the father says, the child, my daughter is simply in her own world. What is she doing in her own world? She is trying to find diversion. And human beings, these excuses that we give is a way of diversion. That I do not want to do that, therefore I am doing this. But has anybody understood what is it in that the person doesn't want to do? Or what is it that what you are doing is giving you? Either way, if you try to find out, sit down with them as a friend, it's a wonderful thing. So these are all the activities that I am trying to do these days. It's not only practice. People till they die, they are only interested in money. Money is not the ultimate criteria. The ultimate criteria is, as a human being, what have you contributed to the society? Our expectations will never end. It's an endless thing. But we should know where to demarcate, where to put a line. This is what I have done. I am okay with this. Now let me do it for the society. Your approach towards yourself and your approach towards the society changes. Tell me, you will be surprised to see people wait for 1.5 months for an appointment. Others people say, for homeopathy, who waits? People are ready to wait, but people are ready to see you, what you are doing. How many cases I have taken 8 time retakes? I tell them with bowing down to them, please let me take you to sir. And you know what is the statement? I can see the struggle that you are having in treating me. If I die, I will lie here. That is the faith that people develop in you after years of practice. They are not ready to go. And then I wonder why. I asked them, few of them, I sat beside them and asked them. I said, what is their answer? The answer is not about what medicine you are giving, doctor. More than that is your concern towards me, which nobody, even the family members do not have. That touches you and it touches them also. This is humanity. Beyond your profession. And this is what I call, this is a divine profession. Where you are really helping a human being from their suffering. Not only suffering as their complaints, but more than that is what role are they playing in their life. People come and literally fall at your feet. Elder than us. Many a time I tell them, what are you doing, sir? And what is the answer, It's not to you that we are doing. It is not to you, but it is to your skill that we are doing this. That is the time when I understood that people don't adore the statue. Behind the statue, the skill that that statue had, that is something that is adorable. And that skill we cultivate. We don't have it. Nobody has that skill from birth. We cultivate that by doing riyaz. Whether it is dance, whether it is music, we do practice again and again to master it. That is it's in our hand. Please do the riyaz and master it. It will be of some help to somebody. And that help is precious, much more than any money can give you. The internal satisfaction. This is the message that I really today from the bottom of my heart I want to convey. Many of them tell me, so many, you frequently travel to Tamil Nadu, for what? If I don't travel, then also, your knowledge you only want to keep it to yourself. Then also you will say, you're traveling frequently. That time also you'll say. So people are there to tell every time, whether it is good or bad, people will comment. But let your own conscience be clear about what you're doing. Kokan, best example. My own friends, my own colleagues tell me, you are not charging over there. Neither you are doing any good. You are wasting those 40 days in your year. I said, sorry sir. 40 days I breathe clean, fresh air. Mouth is shut. You are staying in a polluted environment 365 days. I stay 362 days. Remaining 40 days I go there to refreshen my lungs and everything. Isn't that my gain as a human being? I'm blessed. And apart from that, what I'm really blessed is there are so many people today messaging and saying, sir, I treated this case with this remedy, this is the follow-up, this is the result. And especially more than anything else, vernacular language people who feel really so shy to talk in English. But at the Gurukul, I made it a point, ask them, I made it a point, talk in your own language, somebody will definitely translate that. But see that it reaches to you. Language is not the barrier. The barrier is you have come here to understand. And if you do not understand, again because of language, what you have done in the college, you are doing the same thing over here. That is not my intention. My intention is, have you grown? In 6th standard, Thursdays we used to have half day. So morning 7 o'clock to 1 o'clock is a normal school. Thursday would be 7 o'clock to 10:30. It takes 15 minutes from the school to home. And father used to practice in the morning for 2 hours. He used to sit in the clinic where I'm sitting down. And he had the main clinic, other place, which was fully flourished. Set practice. This place that he had, which I'm now practicing, is because my grandparents were at home. So patients used to come home. So he did not want that. So he took this room to practice for 1 or 2 hours. That's how I am stuck with that clinic only till now and suffering because of small pace. And I came to the clinic, kept my bag and sat on his chair. He took a foot roller and hit me left, right and center. He said, respect that chair. You are not worthy to sit on that chair. That is the discipline that we have been brought up with. And today that same chair is the one that I always call that is my university. Because sitting on that chair for 30 years, I am seeing patients who have taught me. And sitting on that chair, I have learned from those patients. They are the open book. You can see this, eagle case and everything. The books come later on. Who gave you the information? Is the patient who has given you the information. And then you refer to the books. Na? So who is the first teacher? The first teacher is the patient. And that's the reason why I tell you all, please, when you go back to your clinic, don't think that you're going to clinic, I have to listen to somebody. Don't go with this framework of mind. Understand that which book am I opening today? And I'm going to read that book completely so that I will be of some help to that book, to that person. When he gave the keys to me of the clinic, what did he say? Son, this is the temple. These are your holy books. The people who are coming are the idols. Be a good sadhu to worship those idols. Only then it will be blessed. Don't be in a rat race. That doctor has taken a car, so you have to go for a car. That doctor has taken something, so you go for that thing. No. Once your focus is changed, then your manipulation, malpractice begins. And till today, I still go on shorts and t-shirt to the clinic. This is the dress code only for seminar. Because people around me have seen me from childhood. I'm in the same place, born and brought up. The same half chaddi wala. So now also I'm the same. But does that make any difference? No. People come to you for what? For your skills. That is what I've understood after 33 years of practice. Develop that skill. That is very, very important. And be human to understand other human being. Don't think I'm a doctor, so I'll ask question. No. Keep that DR outside the clinic and then enter and see how beautiful it feels. I don't know, Bhabha, brother, you tell me. Whatever is your story, I don't know, you tell me. When you are a recipient, you receive a lot of information. But if your page is already written with your knowledge, then you cannot write anything else over there. Therefore, enter the clinic with a clean page. And let that person write everything on that page. You don't write. And see the beauty. That moment of time that you are spending with that person for an hour or so will bless you. And that is what exactly we call it as experience. What is experience? This is experience. Not number of years is experience. Many people practice for years together, only with 3 remedies. I have seen. Soranum, Medoranum, Syphilinum. Only 3 bottles in his clinic. Any patient who comes, if there is hope, give Soranum. If there is psychotic, give Medoranum. No other remedy. 40 years of practice. 40 years of practice. 50, 60 patients at a time, any time given day. What case history, God knows. What remedy, God knows. But 60 patients every day, that means definitely there is results. Otherwise people will come. That also is a question mark for me. And then the question mark is, what are we doing? There is no place to keep medicines. The two contrast. So I believe in this, that there is an aura that is emitted by every human being. That person's aura may be with only Soranum, Medoranum and Syphilinum, which is helping him. Our aura may be with so many medicines, understanding in depth. We do not know. You see, some people are very good in treating skin cases and they eventually become skin specialist in homeopathy. Yes or no? It's their aura that is tuning to that skin, which we cannot catch that range. So each one emits an aura which can catch a specific range. This also is true, but yet abstract. Which cannot be explained through any mathematical or physics ka understanding. Nothing can be done. Because there is no metric system in this. Weight into height into breadth into nothing of that sort. It has got no metric system. Only thing is that you have to believe that so many people are passed by, they are treated and he is getting treated. I've seen one of the gallbladder specialists. He's not even not even qualified. He just pinches over here and gallbladder comes out. The stone comes out. Before 6 o'clock only you have to come there. After 6 he doesn't. Shutter is closed. All those who are there before 6 o'clock are taken. With someone else's report, I went inside. I just wanted to see what is happening. And in that crowd, I slowly came out without getting any treatment. But I saw what was happening. Because the curiosity is this, that what is the person doing? One patient went, he came to me, doctor, see this gallbladder stone. Other patient said, after a few months, this gallbladder stone. Who is the person? That person. Now what is that person doing then? What treatment he gave? Nothing. He just pinched over here. If this is seriously, I'm not joking. Whatever. No, he spots the gallbladder perfectly. He gets the pinch perfectly over there. He pinches like that, and it comes out from the intestine. From God knows what jadoo he does. But not immediately it will come. Within 2 to 3 days it comes out. Don't think immediately it is coming in the hand. No, not like that. That miracle will be too much to digest for anybody. But then the understanding what is given is like you put a stone in a balloon and you slowly pinch. If you have to remove it out, it will come out, right? So maybe that is the only logic I can apply. I don't know if there is any other logic than that. If it is a miracle arm fat like this, then I do not know. But he pinches in such a way that the gallbladder's mouth widens and the stone comes out into the intestinal this thing. And another thing, what is the speciality? You have to pass motion for the next 3 days in a net. In a net. That is the criteria. Post-operative management, that is called as. Whether it is operative I should use the word or what word I should use, that I do not know. But that is the fill in the blank. We can apply anything over there. So these are the things that are happening. Right? So Vashani, who has been there in my clinic also for nearly 2.5 years. And now that she has started her own practice, we will see her case in Tamil. And let us see, this is what I was wanting to tell, how the next generation gets blessed. And you feel happy that the next generation is doing so well at such a young age, that they are on the right path. That is the only blessing that I feel what we are getting as of today. Okay.